Hello, good morning. I'm going to adjust this a little bit. And this is a little shaky here. Let me get this. Put my remarks on. Sure. Do you want to put the, okay. Yeah, sure. I can, do you want to clip it up? Okay, perfect.
I'm just going to wrap it so you're not going to see the long cord hanging out, distracting you. No, that can
We
be
just make it work. It's 100% fine.
great. I know you've done this a million times.
Usually they're all clipped to me and on it. Like,
Yep, and you got cords everywhere.
Yeah. Okay, excellent. Are you ready to go? Can everybody hear me with the sound? Okay, great. Thank you all for being here this morning. On June 16th, Governor Parson announced that Missouri was fully reopened. In doing so, he said, quote, "Here we are today, just over 90 days since our first COVID-19 case here in Missouri, and I'm proud to say we have overcome all of these challenges," end quote. But as we have seen, significant challenges remain. Since June, Missouri has been identified as a state in the red zone by the White House Coronavirus Task Force. Cases have increased by 340%. Approximately 1,400 Missourians have died from COVID since March, and 600 Missourians have died from this virus since the governor's declaration of victory. Communities are putting restrictions back in place in a desperate attempt to get this latest surge under control. And experts are warning that once again, we have a limited window to get the situation under control so we can avoid an even more restrictions on movement. The most important thing the next governor of Missouri will have to do is defeat the virus and get Missouri's economy back on track. It's the most important issue our state is facing. We have so many challenges here in Missouri. A virus that is impacting our most vulnerable neighbors. The worst economic shock since the Great Depression. Chronic underinvestment in healthcare and education. Persistent gun violence in cities across our state. And tough conversations about how to make Missouri more equitable and just. None of these things can be sidelined in favor of focusing on just one thing, because all these problems are interconnected. If we fail to get the economic crisis that is devastating budgets at every level under control, we won't be able to deal with any of these issues effectively. What Governor Parson doesn't seem to understand is that we're not going to get our economy back on track, get our schools fully reopened for in-person learning, won't stabilize our budgets to deal with all of these other priorities until we contain the spread of the virus. That's why today I'm laying out my plan to address the coronavirus pandemic and the economic fallout from it. It starts with containment. As governor, I would issue a statewide mask rule. Public health experts agree that wearing a mask is one of the best tools in our toolbox to mitigate the spread of the disease. This virus does not respect city or county lines. And while some places aren't seeing the same levels of community transmission as others, once the virus reaches a community and starts to spread, containment becomes much more difficult. We can't wait for problems to arise. We have to prevent them. That's why nonpartisan medical professionals have suggested that the state require every Missourian wear a mask, inside and outside, whenever socially distancing cannot be maintained. This is a data-driven measure Missouri should employ to get a handle on the rise of the number of cases. Models have shown that widespread mask wearing can reduce future strain on our hospitals and can reduce the number of people that will die in the future due to COVID. A mask requirement is our ticket to freedom because it improves our odds that businesses can remain open, schools can return to in-person learning, and people can get their jobs back. Missouri received billions in CARES Act funding from the federal government to fight COVID, including for contact tracing. Governor Parsons sent a portion of this money to counties and urged them to develop contact tracing programs rather than doing contact tracing at the statewide level. In late July, we learned that only 17 of 81 county health departments had received their share of funding for contact tracing. Governor Parsons' contact tracing program isn't working. It's time to adopt a new approach. I propose the formation of a state-level response team to assist counties in the use of their CARES Act money. Jefferson City needs to do more to ensure resources are being deployed, including on critical needs like contact tracing. If counties need more guidance on how to utilize CARES Act funding, the administration needs to provide it. The State Department of Health needs to be more engaged, quarterbacking the effort to get local contact tracing programs up and running using these federal aid dollars as they were intended. As we move back to school, as we move into the back to school phase of our COVID containment effort, community level management of transition is key to keeping our schools open. Missouri is very far behind where we should be. It's time to ramp up the urgency. In recognition that the virus does not adhere to state lines, Missouri should engage surrounding states to cooperate on the purchase of rapid testing supplies and equipment. Maryland, Louisiana, Massachusetts, Michigan, Ohio, and Virginia entered into an interstate compact to purchase 3 million rapid antigen tests. Missouri should engage the governors of bordering states and other regional partners to combine purchasing power to acquire more rapid testing capacity. Rapid results are vitally important to assembling the data needed to drive decision-making in real time. Missourians also need clarity when it comes to the data driving decision-making. The governor should convene an emergency medical task force composed of the chiefs of medicine for a number of the state's largest hospitals, epidemiologists, county public health officials, and designees chosen by the Adjutant General, the Director of DPS, and the Director of DHSS. The task force should brief the public daily on the condition of COVID-19 in Missouri and steps taken to stop the spread of the virus. The task force should provide recommendations of executive actions to the governor that can and will protect the public health. In the same way that Dr. Deborah Birx and the White House Coronavirus Task Force briefs the media and the public on steps needed to contain the virus, the Parsons administration should be putting public health experts, not just the governor's political appointees, front and center in responding to this crisis. The task force would also be a hub for collecting COVID-19 data, ensuring the state would not have to rely on hospitalization data from the CDC. The state should never again lose control of its COVID-19 hospitalization data. When it comes to getting our schools open and keeping them open, Missouri should again be driven by the data. The state of Minnesota has put forward such an approach to returning to full in-person school. Their model has been adopted here in Missouri by the Columbia Public School District, and similar data-driven approaches are being employed in other districts. Governor Parsons' approach: kids should go back to school. If they get it, they'll get over it, and we'll just see what happens. That's not a plan to return to full in-person learning, because if it is his plan, it's not working. We're seeing school districts across Missouri pulling back from earlier plans to start the year in person. Everything depends on the rate of community transition. We can't get every student back to school until we contain the spread of the virus. Therefore, my strategy on schools is holistic with our broader COVID containment strategy. Everything works together. My school's plan calls for setting clear guidelines and criteria to guide local decision-making on learning models that schools can offer based on the level of community transmission as reported by each county. The guidelines begin with a 14-day average number of cases per 10,000 people in a county. School districts in a county where the number of cases per 10,000 is below 10 can return to full in-person school. When the rate is above 10, different learning models must be employed, such as a hybrid model that splits students into two groups that each attend 2 days per week and then are online on the other days. Finally, when cases rise above 50 per 10,000 in a community, schools must transition to a fully online learning model. Districts need to have funding and supplies to ensure rigorous sanitation, support for virtual learning, and access to rapid testing for teachers and staff. The guidance I am proposing cannot be unfunded. Our school districts can do these things with support from a governor and her administration. I want schools to fully reopen. Kids and working families want that too. But we cannot just say it. We have to take action to make it happen, which is why we need strategic containment efforts. If community spread does not decline, it will only result in schools returning to online instruction. While we implement these measures and closely watch the data for improvement, Missouri workers still need help. As community spread accelerates in some areas and reaches areas of our state previously not impacted by COVID, wage replacement and Department of Social Service assistance is still needed. Governor Parson ended many of the waivers and enhanced employment benefits in early July. This is counterproductive to our economic recovery. The unemployment rate is still at historic levels. Missourians are racking up credit card debt, worrying about the next rent payment, and right now there is a real lack of clarity on what types of assistance remain for those facing lost work. Missouri needs an emergency economic relief council composed of business leaders, representatives from labor, small business owners, public health experts, and economists to advise the governor's administration on economic stabilization in the short term and economic recovery in the long term. Missouri needs action and leadership to fight COVID-19. Governor Parson's strategy isn't working. Cases continue to be significantly higher than they were in the spring. School districts across the state are delaying their reopenings. The lingering effect of the pandemic threatens to hobble a full economic recovery. The plan I have laid out is designed to prevent another widespread shutdown. Defeating the virus shouldn't mean shuttering businesses, closed schools, or lost wages. But simply continuing down our current course risks going backwards as transmission and case rates continue to climb. Missouri needs a reset on our coronavirus strategy, and fast.
Great, thank you. We're going to have time for one quickly one, so we have to move quickly, so if we could just turn the votes on.
Okay.